Welcome to day 3 and our last day of Smart Beginnings 2024, Early Beginnings to Bright Futures. It's wonderful that you've joined us today as we conclude our 3-day mini conference designed to strengthen the developmental and educational outcomes for infants, toddlers, children and youth with disabilities, and of course, their families. Whether you've been with us from day 1 or you're just joining us today for the first time, we're excited to engage with you on the vital topics that support our youngest learners. Smart Beginnings is also about building strong foundations. Throughout these 3 days, we've been exploring ways to enhance outcomes, deepen family engagement, and advance equitable access to high-quality early intervention and education through evidence-based practices. Today, our focus turns to early childhood, a stage of life where Smart Beginnings can absolutely make a lasting difference. Today's sessions will delve into essential areas that are critical to early childhood education and development. We'll explore social and emotional outcomes, recognizing that social and emotional development forms the foundation for all learning and well-being. We'll discuss strategies to support this vital aspect of young children's growth, ensuring that they have the tools to navigate relationships, manage emotions, and to thrive. Another key area of focus is leveraging technology in early childhood education. When used thoughtfully, technology can open doors for learning and engagement, helping us meet the unique needs of young children and their families. We'll also emphasize the importance of collaboration, building strong partnerships across disciplines, among educators, service providers, families, and communities alike. It is essential to creating cohesive, supportive environments where every child can succeed. Additionally, we'll address the critical issue of personnel recruitment and retention. High-quality early childhood education depends on having skilled, dedicated professionals. We'll explore innovative strategies to attract, support, and to retain the early childhood workforce, ensuring our programs can meet the needs of all children with disabilities and their families. In addition to today's live stream sessions, I'm pleased to share that we have prepared additional video presentations that delve deeper into the unique needs and experiences of the populations we're focusing on today. These on-demand videos provide an opportunity for further exploration of the themes and topics discussed and offer valuable insights into the resources that are tailored to specific groups within the early childhood community. Throughout today's sessions, you'll hear from OSEP leaders, early childhood experts, and finally practitioners who will share actionable insights and strategies. I encourage you to engage fully, ask questions, share your experiences, and connect with your peers. Thank you for your dedication to supporting young children with disabilities and their families. The work that you do is essential to shaping their futures and making sure that every child has the opportunity for a smart beginning. So let's get started.
Good afternoon, everybody. So happy to have you here today to hear from Aaron and I as we talk through what has been going on in the state of Delaware around optimizing social emotional outcomes by supporting their early intervention professionals. So again, I'm Meg Nelson. I'm from WestEd, a technical assistance provider through that company, and I'm joined today by Aaron Rich, who is the Part C coordinator in Delaware in the Department of Health and Human Services, and also by my colleague Leslie Fox from WestEd. Today, we're going to go over briefly Delaware's early intervention program structure and then review their SIMR, or their state identified measurable result, and how they approach supporting early intervention professionals in the work around the SIP, or the State Systemic Improvement Plan. And then we'll move into a poolside chat and hear more directly from Erin about how she took on that work and really moved it forward in supporting the early intervention professionals in her state. So I'll turn it over to Erin to get us started with the structure of Delaware.
Thank you, Meg. Good afternoon, everyone. So in Delaware, the Birth to Three Early Intervention Program is under the lead agency of the Department of Health and Social Services. And then under that umbrella, we are under the Division of Public Health. Delaware is a very small state in size and population. For FFY 2022, our child count was 1,566, or about 5%. Within the state, we have 2 regional programs, and our service coordinators that work in those regional programs are a mix of state employees and contracted employees. And then our early intervention providers are all contracted professionals from big and small agencies. Our state identified measurable result in Delaware, or SIMR, says that Delaware will increase the number and percentage of infants and toddlers who enter early intervention programming below age expectations in the area of social emotional development, and increase their rate of growth by the time they turn 3 or exit the program. Why? Our COAST data, particularly the exit data, was showing a lack of improvement in the area of social and emotional development. And so the program, in partnership with recommendations from OSEP and our stakeholders, decided to focus on social emotional learning in our SIMR. So how did we choose the tool, the Behavioral Assessment of Baby's Social and Emotional Style Toolkit, or BABES? The original plan and the attempts to support our early intervention workforce in improving social and emotional outcomes was broad. Staff and stakeholders created work groups made up of Birth to Three administration, early intervention providers, family service coordinators, ICC members, representatives from PIC, which is our Parent Information Center in Delaware, as well as a few parents. These work groups finally whittled down to identifying 2 priorities: professional development and assessment practices. So the assessment practices work group explored and researched many different assessment tools, searching for a family-directed assessment tool. We wanted something that was high quality, of course, research-based, and we also wanted it to be family-friendly. We wanted it to be easy to administer. We wanted something that really emphasized social emotional concerns. And we wanted, if possible, something that not only asked questions, but offered some strategies, some supports, or maybe even some solutions to the concerns that parents brought up, rather than just giving a score. So ultimately, then, we landed on the BABES, or the Behavioral Assessment of Baby's Social and Emotional Style Toolkit.
And the BABES is a tool that was developed by Karen Finello out of WestEd. And so Delaware decided to contract with WestEd to provide some direct training to the family service coordinators to get them started on how to use and implement this new tool. So Delaware contracted with WestEd to deliver a 2-part training series with their FSCs. The first part of the training series was done in person over 2 days and really focused on foundations of early childhood development, including the social emotional skills, and helping the family service coordinators learn more about how to approach talking about social emotional skills with families and the importance of that initial relationship building between the family service coordinator and the family, in order to have those conversations. And so then by the end of it, the family service coordinators would really have a better foundation or a better knowledge base and skills to help improve collaboration with families to support behavior and resilience in their infants and toddlers. Then the family service coordinators had the opportunity to go away with the tool, read it on their own, learn a little bit more about it, start to put it into practice. But Delaware found that they were still having lots of questions about how to actually implement it. So they asked WestEd to come back, and Leslie Fox did a virtual training that really allowed the FSCs to engage with each other and practice doing mock interviews and become more effective at using the tool. And all of this was part of kind of Erin and Delaware's approach to supporting their early intervention providers and using that continuous quality improvement kind of method, or the Plan, Do, Study, Act, which you may be familiar with. And what we've started to talk about is really that planning phase that Erin engaged in. And we're going to move now into what we call a poolside chat and hear more about the Do, Study, and Act components that Erin used with her work groups and with the family service coordinators. So with that, I'm going to take the slides down and have a chance to just talk directly with Erin. So Erin, if you could start us off just by saying a little bit more about how you went about planning to support your family service coordinators and increasing their knowledge of social emotional development. You've talked a little bit about the assessment practices work groups and how you trained them. And once that training was going on, how did you get feedback from the FSCs and implementing it, and kind of what was that process like?
So we utilized surveys. And from the very beginning, from the training piece, it kind of laid the foundation for how we would do things moving forward. So the 2-day in-person training that Meg mentioned, that was really kind of a foundational and had a lot to do with childhood development. We asked FSCs as a result of that for feedback, and their feedback was that a lot of great information, but it wasn't directly related enough for me to feel ready to start implementing this BABES tool. They asked for a training that was more specific and more hands-on with regard to the tool. So then Leslie Fox came and she did her sort of more babes in real life kind of training, where she gave examples and she talked about how conversational the tool could be, and gave some really valuable tips about how to make the conversation flow and seem natural, as opposed to, reading a list of questions from a checklist. Feedback from that training, again, we get sent out a survey to FSCs. Feedback from that training was that it was very helpful, but they still wanted to see the babes in real life. So as a result of that, we created a video of an FSC actually giving the babes tool to a family, going through the questions and having the conversations that might organically come up. Feedback to that training was very positive. So we felt like FSCs were on solid ground to start implementing the tool themselves. And then after implementation, which started small, we started by just using the babes with any new families that were coming into the program. So FSCs would only have to use the tool at an IFSP meeting with a new family. So feedback, we periodically would get feedback from them about how that was going, and then we would respond to that in whatever way made sense. So our strategy was to repeatedly ask for feedback and then be very reactive in terms of support, professional development, training, resources, whatever sort of emerged as a result of the feedback from the boots on the ground staff.
Thank you. And I know that one of your ultimate implementation objectives through the SIP was for your family service coordinators to gain confidence in discussing social emotional development with families. How have the data from the post-training surveys that you were talking about just a second ago kind of borne that out? What have you seen there in terms of their confidence level?
So exactly, one of the questions that we ask on our periodic check-in survey, as we've come to call it, which we would distribute to FSCs quarterly, the same survey with the same questions so that we can compare results, has shown that over the past year and a few months since we first implemented, confidence in administering the tool has increased, and the level of comfortability that FSCs have with the tool has increased. And FSCs are also feeling as if they're able to have more meaningful conversations with the families that they work with around social emotional concerns, social emotional learning, social emotional development.
That's great. And I know that you mentioned earlier in our presentation that one of the kind of driving forces behind why Delaware chose social emotional development as its focus for ESSIP was your child outcomes data related to indicator 3. Have you been able to see progress there, or is it too soon? What's your take on that?
I think it's too soon for me to say program-wise whether those social emotional outcomes have improved across the board. But I do know from one of our larger provider agencies in particular, who their administrator has been very involved in our ESSIP work groups. She's been a part of this effort since it started before I came on board. So she's done her own internal research just on the Exit Coast data that they touch in their program, because early intervention providers conduct the Exit Coast in Delaware. And she reports that for the kiddos that are going through their particular agency, those numbers have increased. So she is, since we've been doing our work, seeing better outcomes around social emotional concerns, outcomes in the Exit Coast data.
That's great. And I think, we're approaching the end of our time. Maybe if you could just touch on any barriers that have come up, how you've overcome them, and then what your next steps are for.
I would say one of the biggest barriers is that FSCs repeatedly come back to us asking for resources. And that sort of branches out into a few barriers. One of them being that it took us a while to really hone in on what was meant by resources. So are you talking about, a warm body, a therapist that we can send out to the house? Are you talking about community resources? Are you talking about tips and strategies? And so gradually we've come to learn that they're talking about all of the above. So we've been working on finding resources wherever we can, and we've created a channel on our Teams network where we repeatedly load in resources of any kind, whether it's an agency that might help, whether it's a community event, whether it's an article that might be helpful. So we're working to shore up our resources in that way. And then related to resources, in going back to FSCs and their supervisors, they have identified 3 major areas that they are seeking resources about. And those are feeding, sleeping, and behavior. Those are the 3 main areas that families are expressing that they need help, that they're having trouble. And so our next steps with our work groups are that we are working to create webinars that bring in expert early intervention panelists to talk about those various issues. So our first one, because it was most popularly asked for, is going to be about feeding. And so we will have experts from our EI provider pool come and talk about different aspects of feeding as it relates to social emotional concerns particularly, and allow FSCs to come and ask questions, propose, case study issues, and we'll record that so that it's a resource in perpetuity for staff to make use of.
Great. Well, those all sound like great next steps, and we'll look forward to following up with you maybe in a year and see how that outcome data is coming along.
Sounds good.
So thank you all for your time today. If you would like to get in touch with Erin or myself or Leslie, I've put our email addresses up there, and we'd hope to hear from you. And I know that I would be happy to answer any questions, and I'm sure that Erin would be also happy to answer any questions, especially from those of you who work for state lead agencies. With that, we thank you very much for your time today.
Thank you.
Hi, my name is Mindy Allen. I'm the creator and founder of the Nesting Guide Data Initiative. This is a presentation for leveraging technology to increase connection rates in early childhood. What is the Nesting Guide? The Nesting Guide is a highly curated data-based initiative to better safeguard our maternal and early childhood communities. Where did this vision come from? It was conceived from our journey with our son. He was misdiagnosed with pervasive development disorder at 23 months of age. This vision originates from not being given any pertinent information and feeling isolated without any knowledge, and just leaving the evaluation results and processing this life-changing news. My key discovery about 2 months after our son was diagnosed by an agency in North Carolina. We lived in Wilmington, North Carolina at the time. We found a pediatrician in Charleston who specialized in environmental medicine during our search. Our speech therapist connected us to him because she thought it was environmental. He had teary eyes and eczema all over his skin. So the doctor, when we finally got to in front of him, he determined that those symptoms were likely due to ingesting lead paint, airborne particles during our home renovation. We had a 1925-year-old home in Wilmington, and I was pregnant. I was 6 weeks pregnant, and obviously the lead airborne particles were invisible. And as I supervised the addition, I ingested those particles at that time. What is the core of the Nesting Guide and the game changer? The game changer was when our son, he was 5 years old, going into kindergarten, and we were finding out the results if he would be eligible for services, and he was not, as well as his diagnosis was reversed at that time. It was due to the lead poisoning. But in this particular instance, we pushed out that it was because of early intervention. And that was 2004. We did not have what we have now for early intervention services. It was a struggle for me to even find how to get a diagnosis. So much, we have improved much from the time that I was in this experience. But I was provided with the knowledge of environmental factors causing developmental delays, and that was key. And then at that evaluation, when I found out we weren't going to see our speech therapist on Monday and our services were over, I left the evaluation and I vowed to find a way to make this journey easier for other families with special needs children, or children or in your pregnancy, or maybe they need help trying to get their child evaluated, so, like I did. So that was in 2008. So what was the catalyst? When I finally decided to create the Nesting Guide, it was April 2022. I was helping. I've been working with the College of Charleston, Professor Dr. Ira Jungles in information technology since 2021. And our inaugural student needed to find statistics on the causes and effects of intellectual disabilities. So for the first time, I was looking on the ARC website and saw their position statement and read this article, and I knew right then that I would create this Nesting Guide, and I started then. And then as I clicked around the ARC website, I found, and I'd never seen it before, and I think they've been established since they were established in 2016, but it's the ARC's Environmental Research Initiative, Project Tinder, Targeting Environmental Neurodevelopment Risks. So that's just where it hit me, and I knew And I read this statement: knowledge about biomedical causes of disability, preventative health care options, and the consequences of exposure to environmental hazards is increasing rapidly, yet the practical application of this information is lacking. So I thought, well, let's create the practical application and bundle these educational materials. So I also, at that time, I saw the environmental neurodevelopment risks, and then I further researched what are the other risks, and there are healthcare neurodevelopment risk or healthcare disparities, substance abuse, fetal alcohol syndrome, mental health or unresolved grief and trauma, and community and home safety neurodevelopment risks. So what's our mission? We are able to provide a uniform system on a local, state, and national level because the educational materials are non-demographic specific and non-income specific. We're better able to connect the maternal health care and early childhood development communities to that time-sensitive data points. For example, we have a March of Dimes birth plan. We don't need to see that after the baby's born. It's a time-sensitive document that we can curate in a proper order. We also improve maternal, newborn, and early childhood development outcomes. So how does this benefit? Who does it benefit? What does it benefit? Where? It starts with OBGYNs, maternal health care, preconception, prenatal, pregnancy support. The baby is born. The baby is either in the NICU or the baby is discharged home. And these are basic needs so that you have these resources at your fingertips. If you are in the NICU, perhaps you're in the Ronald McDonald House or your home. And so you're getting this support for child safety, maternal health, parent and child interaction. Who are the other benefactors of this, of the Nesting Guide? Maternal aftercare, the pediatricians, the parent support groups, nurse home visitation programs, and early child care development providers. How is it curated? We have categories and then we have subcategories. I will not read the subcategories, obviously, but we have prenatal health, maternal health, new parent support, maternal support, maternal support, baby safety, infant and child care, infant health, and new parent financial support. How is it curated? It has the name of the resource, a short description, and then a link. We're also able to share and heart or favorite our resources when you sign in and sign up so that you can come back to your list. Why is the Nesting Guide important, or why is this cause important? Maternal and child health care is one of the most important investments a country can make to build human capital and boost economic growth. Has an ideal system to monitor childhood development been located? When I started working with the College of Charleston in 2021, we actually used Texas for our model. We located My Health, My Resources of Tarrant County Child and Family Services, and we immediately saw that this was an ideal system and infrastructure to monitor early childhood development. And the North Texas, those are the 12 counties that the resources through their ECI, they're able to use these resources. And it also leverages existing resources that complement each other. None of these resources are duplicate. They're duplicative. They work together. Their early childhood intervention, they have one email, one phone number, and one by county. The Family Connects leverages nurse visitation and home visitation program. Healthy Steps is a pediatric team 0 to 3. Help Me Grow is a national organization that promotes early childhood development, has a huge grid of resources, as well as ages and stages of questionnaire for free. They have the IEC mental health consultation and parent cafes, which is a support group for new parents. So what are the goals and the impact of creating a single web-based system to consolidate the process and dissemination of the data? We can provide with this data increased and earlier connections between the parents and community resources. We can promote safe sleep habits. In South Carolina alone, MUSC reports 8 infants die a month due to safe sleep habits. We can promote car seat safety, breastfeeding goals, maternal mental health, and we can reduce environmental hazard exposures. What are the goals of also the continuation? We can leverage the critical window of time from birth to 5 years old, such as we did with our son, to maximize the impact of early childhood intervention when needed. We can also reduce the infant mortality rate by prioritizing safe behaviors. And so why is this a solution? It helps us identify potential neurodevelopment risks. It has the Nesting Guide has a quiz in the considering pregnancy tab. There are 3 quizzes for are you considering pregnancy? Are you pregnant? Are you a single parent? And it's an anonymous quiz that helps you identify those risks and tease up resources if there are risks. We can incorporate time-sensitive, highly curated educational materials, videos, infographics, and documents, such as going home and your baby is crying. You don't know why. We have a section on crying and how to swaddle your baby video. That's a great solution. Directory that categorizes and disseminates comprehensive preconception, prenatal, cradle to kindergarten data in one online portal. You can learn more about the Nesting Guide. Here's my email. We have an exciting initiative that will be launched and start while I'm at the conference in August. The South Carolina expansion of the Eco-Healthy Childcare Endorsement Initiative. We have Texas Health and Human Service data sets. We have military data sets. To learn more about our Tech for Good initiative that the College of Charleston has developed that works in tandem with the Nesting Guide, you can contact Dr. Iris Jungles. That is a data collection project that works with the data initiative of the Nesting Guide. Thank you so much.
Welcome to the 2024 Smart Beginnings virtual conference. We're excited to be here. I'm Dr. Kristen Vadova, and with me is Dr. Carol Johnson, here to present about the 325 Leadership Early Childhood Collaboration Grant, Resilient Early Intervention Leadership. This grant we applied for in North Dakota during COVID, and we found that it's been a complete pathway to change for North Dakota early intervention. We'd like to share the story of how that grant came to be and the different tiers and parts of the grant and where we're headed in utilizing the funding for the grant and creating a new sort of vision for North Dakota. This grant, the Leadership Development Program's Increasing the Capacity of Leaders to Improve Systems Serving Children with Disabilities 325L grant, was awarded to North Dakota in 2020. And North Dakota received nearly $200,000 a year for 5 years. When we wrote the grant, it was during the beginnings of COVID, and we had been working for about a decade with a vision for North Dakota and where we wanted to be. We were searching for funding and trying to create something that would support our current efforts and support what you see here, which is our North Dakota State Systemic Improvement Plan Theory of Action, where we had 4 strands: data quality, professional development, evidence-based practices, and policy and procedure that we had been working on for nearly a decade, and wanted to find a way to further support leaders in North Dakota.
And this grant just really gave us that opportunity. So when we looked at what projects would develop under this grant, our focus really was, how are we going to develop local leadership? And not necessarily coordinators or administrators, but people practicing in the fields, families, looking at that engagement so that we could see growth, confidence, and competence across North Dakota. And through that, we developed different subparts or projects to the grant that would meet this really overall leadership across an array of practitioners, families, and stakeholders.
For nearly a decade, we've been working to increase capacity of local leaders in North Dakota, and that meant parents, family members, local practitioners, and service coordinators. And with this grant, we felt like we could create a real wraparound support, especially during COVID, for everyone that we were trying to create locally as engaging in leadership with their strengths. So we named the grant the Resilient Early Intervention Leadership Grant. And we really, from there, went forward with many different parts of a big project that has really come to fruition and made a huge difference in our state.
And the considerations that we really looked at, we're a rural state. We know there's different kinds of needs in the rural areas versus more urban. During COVID, people were separated from each other. So what kinds of supports did we want to build in to really provide the necessary things that individuals needed? We wanted to be able to have engagements and relationships. But when we looked at stakeholders, we really wanted a broader vision than we generally have. We've always felt families had to be partners with practitioners and service coordinators throughout all of early intervention needs. But we really looked broader than that, and looking at children with disabilities are a part of every facet of our community. And so anybody who has their hands in a certain way on our children, whether it was childcare or early Head Start or higher ed, where they were supporting other people, we wanted to bring them in a part of this grant to support that, so that we would have stakeholder involvement across the community and be able to support families. So the biggest thing is, how can we build confidence and competence so that our stakeholders feel like they understand early intervention, they can be supportive of early intervention, and that then carries over to really supporting families as true partners in early intervention.
So next, we'd like to share the different parts of the grant, the work that's been done, and then our future directions. The first thing that we did was set up a REAL, and again, that's Resilient Early Intervention Leadership Grant Advisory Group. And we recruited members. And just like Carol just said, these members were meant to be broad and not just in early intervention, but stretch out to all of our collaborators across the state, from family members to agencies and community members. Another big aspect for us was supporting them through stipends to attend meetings, especially those family members, and creating a network around early childhood to better understand early intervention, but also, again, create that team collaboration for future work. The REAL Advisory Group came together. We had one lead person, Roxanne Romanek, who recruited and brought this group of 15 members together. Representatives included family members, tribal representation, service coordinators, early intervention providers, the broad early childhood community, which could be Head Start, early Head Start, childcare. Everything was open for us to create this community. The REAL Advisory Group meets quarterly, and it focuses on reviewing the different parts of the grant, discussing the grant activities, considering this current state landscape, where we were headed, and where we could go with all of this funding, and really focusing on local leadership.
The next area that we really looked at was a competency development work group. So really looking at those early intervention competencies that would build leadership. And so that group we had 10 members, they met monthly. They really looked at what kinds of assessment tool would be helpful to early intervention, what kind of materials would be there. And again, we looked at those stakeholders across the early childhood education field so that we would look at competencies across all areas that our families spend time in. And these are some of the products that we have. We have a manual that came with. There's separate areas to look at, And you'll see right in the right part, there is a
Google link, a link to our
yes.
early intervention professional development website that links to all of these products, which also includes the 5 strands the group created. We should give a shout out to ECPC and Mary Beth Bruder. A lot of their work and time was spent reviewing a lot of the work they had done, and then creating this for North Dakota around leadership and competencies to help our professional development system, but also to make it available for everyone in the system.
The RELC was a really exciting project that we worked on, because if you remember when we talked about, we started this during COVID. And so we really wanted to look at what are those resilient things that we could look at for leadership, and looking at ourselves first so that we're prepared to support other people. And we included 100 people across the state from a variety of areas: public health, county social services, as we've talked about, early Head Start, early intervention. And they met monthly to look at webinars. They also got a lot of support materials that they could go in and look at in between that month. It spanned 14 months, and this was an area that people really talked about. And I think the impact of COVID was certainly impactful, that this was an important project, but we do really hard work in early intervention. And so I think it's something we should consider throughout the time that we support people in early intervention. The topics were just really looking at your relationships, your internal beliefs, that self-control, things that individually impact you and reflect in your leadership. Adult resilience, family resilience, racial equity. This was, when we were done with the 14 months, people wanted more. They wanted to continue that. We had 100 lines. We actually had extra people come on, and we had to reach out to those that were invited because they shared the link, and we needed to keep it to 100 people. But this was really an exciting project for us. It really spoke to so many people. When we look at the data on that, when we looked at the collaborative webinars, we asked, has this increased your confidence in key principles in leadership? And you can see that it was very impactful for people. There, some were exceptionally that it really helped them. You could see where it is. There was a few that it wasn't as much, but we can see that there was a big impact.
There were so many comments that were shared from the RELC, but these were some of the top points that members, participants listed in a survey. They really focused on their personal strengths. The RELC was built to focus on yourself and then be able to think about your strengths and challenges, so that at the end it could focus on families that you work with. And I think that showed throughout the entire process.
And even though this project was completed a while back, we still hear when we're on meetings, people will use terminology or things like, I have to address the emotion first. I need to look at that. We just really see that this was so important. And again, it was at a time that was very important, but people have continued to really learn from this and build from those components.
And the next sort of tier or level that was contained in this grant is the Early Intervention Leadership Certificate. This was in partnership with the University of North Dakota, where 2 cohorts were created that started in January 2022 and 23, where we recruited professionals, parents, students, graduate students to get a graduate certificate in early intervention leadership, with a lot of learning, tuition and materials provided, and a lot of mentorship and discussion.
And this certificate was built, it was like Dr. Vadova said, it was a graduate certificate. So all you needed to do to get in is we need to have a bachelor's degree, and we wanted to include families. We wanted professionals across the area, and we really wanted it to overlay what our theory of action was, so that if you think back to where we shared that theory of action, We wanted leadership, but we also wanted to really bring along their skills so that they increase their competence and confidence in areas of evidence-based intervention and really looking at an array of early intervention components and what was important to early intervention, and then really move into that resilience and leadership so that they had a very good understanding and supporting on evidence-based, with a culmination to end up with a project at the end that was based on individual areas of interest around early intervention that could take those leadership skills to the next level.
We had a great impact. Actually, we just had a real advisory group meeting where we reviewed final projects and the impact. Some of the members have gone on to really make a difference. Well, they're all making a difference in their community and their leadership. Some have gone on to doctoral work, taking on leadership positions in Part C. Others have created documents that live on in their programs or are being used for state, to become state documents and handouts. So there's so much work that was completed that's going to live on in our state for the future. And part of this grant was that we really grounded it in the DC recommended practices around leadership, and everyone, especially in that coursework, learned and created a project that was linked to the DC recommended practices around leadership.
And these are some of the data points throughout the project. We did collect pre and post and mid-level survey so that we can adjust and meet the needs, but we were really looking at, is their confidence and their competence increased in those resilient leadership components? And you can see that there was at least half of them were completely, and it over 40% almost. So that it was a program that really impacted those areas, as well as their confidence in the key principles of early intervention and really looking at some of those evidence-based strategies. And this was looking at the lessons within the coursework. Did it aid in resilience? And you can see that there, that was about 70% was completely and 30% almost, which was incredibly exciting to see.
Lots of comments. The first cohort, anything that was a challenge, we really revisited, looked at, and tried to make a difference for the second cohort. But definitely the learning, the impact on the person and then their community, their family, really made a difference. We have pages and pages of great qualitative comments, but also really thoughtful challenges that occurred about how the coursework spanned during that first cohort that we were able to change for the second cohort and make it a little better, and really thinking about suggestions for the future for a certificate that would live on and continue to be available to help early interventionists and those that are interested in early intervention at the University of North Dakota. Overall, this grant is not done. It continues into its 4th and 5th years. The Real Grant has a bright future due to these layers of activities that came about. Our goal was always to end up in a place of how can we support coaching and mentorship and reflective supervision and learning. And through the help of the advisor group and state directions, the grant has landed at really promoting and scaling up the pyramid model in early intervention over its last few years. And this coincides with some great state initiatives, including a preschool development grant where all of early childhood is scaling up into the pyramid model. So in the end, it's really come together because within the early intervention certificate, students were learning about the pyramid model, and now they are set to help become the local leaders in the grant's future, which is really awesome. But I think we found, Dr. Johnson and I, that the real takeaway was leadership is action, not position. It's appreciating where you're personally at and where you can lead from and help others and enjoy and understand early intervention and take it to the next level. If you have any questions, please feel free to reach out to us. We're always interested in what others are doing, new ideas, suggestions, or a great discussion. Thank you.
Thank you for this opportunity.
What terrific presentations. Thank you to our presenters from WestEd, the state of Delaware, nestingguide.org, and the University of North Dakota. I'm David Emenheiser, and I work at the U.S. Department of Education Office of Special Education Programs, known as OSEP, in the Research to Practice Division. We will now begin the question and answer portion of the session. At this time, I invite our presenters to join me on screen. And participants, please submit your questions using the Q&A feature. We already have a few questions, and we will address as many questions as time allows. Any questions that we cannot get to will receive email responses. So the first question is for Meg, and it concerns family engagement. Did you survey families to get feedback on the use of Babes? Maybe share any sense of family satisfaction in both the selection and implementation of the tool.
Yeah, I'm happy to. Thanks, David. So families were part of those initial work groups that Delaware engaged when they were embarking upon deciding on what tool they wanted to use. So there were a fair amount of families who were part of that and are very aware of the Babes and were supportive of its implementation. What Delaware found over time was some reluctance for families to participate in the Family Directed Assessment, or the FDA, which is a voluntary participation process within the IFSP development process. And the Babes tool was the tool selected to be used for the Family Directed Assessment. So while they helped supported their FSCs and being able to talk with families about social emotional learning and the Babes, Delaware also created a short informational video that's now housed on their website. We can put a link to that. And that goes over what the FDA is, what its intent is, a background of the Babes toolkit, and how participation in the FDA and using that Babes toolkit can be both beneficial to families, but obviously up to the entire IFSP team in developing appropriate outcomes for the child and family. Delaware is contracting also with the University of Delaware. University already does their family survey for them annually, but they've added to that contract an allowance for the university to conduct more targeted parent focus groups and parent interviews to get a better understanding of families' kind of understanding of social emotional learning and how they can support their child in social emotional development. And so they're awaiting results of that. They just implemented the use of the Babes in April of 2023. So they have about a year now, or a little over a year of families who've participated to pull from. So hopefully we'll have more information about how the families are feeling about things after that survey is completed and the results are reviewed.
Great, thank you. Mindy, you get the next question. You mentioned the South Carolina eco-friendly child care expansion effort. Could you talk a little bit more about what that is?
Yes, of course. So I'm in Charleston, South Carolina. I work for the Family Resource Center for Disabilities and Special Needs, or a regional parent center. The Eco Healthy Child Care is an award-winning and science-based program of the Children's Environmental Health Network in Washington, D.C. And it's the only national environmental health endorsement program for early care and education providers. And it partners with child care professionals to reduce environmental hazards such as pesticides, lead, unsafe plastics found in and around child care facilities. They have a 35-point checklist, but only 5 are mandated. And they endorse through an e-learning course, through the application, and then fix whatever issues are needed to be fixed. Such as lead paint peeling or I can't think of another example. Pesticides. They spray pesticides on Fridays so that children are not exposed during the weekend, and then when they come back, it's safe. So in 2022, I started to build the nesting guide and research the data. And I had the unique opportunity to meet an environmental specialist in Charleston he does abatement for asbestos and lead. And I told him my story, and we kept in touch. And he was one of the first people that saw the nesting guide when it was done in November 2022. And he informed me at that time, and of course I'd done the research on the eco-healthy childcare endorsement. And he said, I'm starting a preschool. I'm building it right now. And I looked up, there was no preschool in the Low Country. And here we are in Charleston. That's one of the oldest cities in America. So I just tucked that away that he was starting that. And I said, well, we'll be in touch because you will want to be endorsed when you open. And fast forward to 2023, and I attended the Help Me Grow virtual conference, and the keynote was Miss Witherspoon, who's the executive director of CHIN, and she was talking about the endorsement. So as soon as the conference ended, I contacted my environmental specialist, Spencer Turner, is his name, and I said, guess who's going to be the first school endorsed in the Low Country? Because there's 3 in the upstate. Clemson University has an early child care center, and there's 2 others. And so he followed through with the endorsement. And we said, okay, what can we do to bring this more awareness to this issue in South Carolina? So we contacted CHIN and the eco-healthy child care director got in touch with us immediately. And she said, okay, you just want to have an article, but I see a bigger picture. Our board chair is at Medical University of South Carolina, and he's the co-author of the CDC managing elevated blood levels and recognition and the management of pesticide poisoning. And he's right there in Charleston. So we kept meeting, and we came up with the idea of starting a first ever of its kind. They work on a national level for the South Carolina expansion of the eco-healthy child care endorsement. Right now, we're assembling our board and our advisory board. We have a goal to set 30 school endorsements in the starting in Charleston. We've identified a lead poisoning prevention grant. We have a volunteer program manager, and everything is lining up very well for us to start an endorsement fund. So this is going to be a great year for this new initiative, and we'll be the first state. We have the first marketing materials, first PowerPoint, first one pager. So it all will start in Charleston. So very excited.
Yes, thank you. So the next question is for Kristen. Across the nation, we face a severe, how about if I say it this way, overabundance of unfilled early intervention positions. And that really interferes with the capacity to provide services to infants and toddlers and their families. Can you talk about any indicators that participating in the REAL project increased personnel and their retention or capacity in the field?
Yes, I think we can see, like we talked about in the presentation, great impact on the doing and the mindset of collaboration and supporting each other, especially through that RELC resiliency project and through really wanting to be more involved and make a difference. So we're finding that those that participated, especially in the certificate and those webinars, are staying around in the system with that feeling of support. Sort of jokes on us when we thought, oh, COVID at the beginning, this is something to support, not realizing what would come, the immense time after and the struggles for retention and recruitment. But we are relying further and placing our real belief in that supporting evidence-based practices through the pyramid model will support the provider and then ultimately the family, so that we have the skills to support each other through these times and retain who we have, and also reach out to institutes of higher education to further make a difference in supporting those students to come and work in early intervention.
Very good. So I do want to encourage participants to, at this time, to put some questions in the Q&A feature if you haven't yet. We do have another sort of set of questions that for each of you, but I'll target them a little bit. This is about sort of outcomes. So this one, let's start with Mindy. Have you seen any impact of the use of the nesting guide on types of services, child find, or delivery of services in maybe the development or implementation of IFSPs?
Well, we just started, even though I've been working on this since 2021 with the College of Charleston. We initially just started, and now we're bundling all these three initiatives. So, more to come.
Okay, we'll look forward to that. So for
Me too.
Meg, has yeah, how has using the Babes Toolkit as that family-directed assessment impact the types of services that might be included in IFSPs?
That's a great question. So Delaware has one or two, I would say, mental health kind of background providers, and some of that goes to that overabundance of need, in service provision, or service providers rather. And so they've done quite a bit of work too with training their early childhood educators to be more comfortable addressing some of the social emotional pieces if they're not rising to the level of needing somebody in more of the psychological or mental health capacity on the service delivery grid. So I would say that there are more clear and direct and achievable outcomes being written based on the use of this tool, and also because of the service providers and the service coordinators being more comfortable talking about social emotional development with families. And so, I don't know that we've seen a drastic shift yet in who is providing the actual service, but definitely more clear, like I said, clear outcomes around social emotional learning for children, and then more comfort from the FSCs, the providers, and now the families too, and kind of joining and partnering in addressing the social emotional needs of the young children that are being served. And, Aaron alluded to kind of the three big concerns, and for the families that they're seeing are around that feeding, sleeping, and kind of emotional regulation, all of which, the feeding piece, sometimes they'll call in a speech language pathologist or an occupational therapist to help address, depending on what the need is there. But generally speaking, they're sticking to the kind of the big providers of OTPT, speech, and then early childhood education, and then calling in that social worker or licensed mental health counselor if that's needed.
That's fantastic. So for Kristen, I wonder if you've heard from your scholars about any changes in their confidence or competence with IFSP development and implementation as a result of being part of your leadership development project.
Definitely a part of the learning. Well, all aspects were about promoting early intervention and how we could work together with other agencies. That's that collaborative of 100 people. But the students, family members, providers that went through the certificate, they had this wonderful view of, relearning the philosophy of Part C, grounding themselves in the regulations, and how that family-centeredness can really impact those moments. And in our state, we've really focused on functional outcomes over time. So this was the big buildup to this moment to further work on it. And I really believe that valuing how that team works together and valuing the family makes a difference. We didn't study IFSP outcomes per se as a part of the REAL grant, but we've done it through a functional outcome framework to really make a difference in our state. And it all goes together for us, thus coming to that moment of the pyramid model and really supporting the family social emotionally. And we do expect to see changes over the next few years and improvements in practice around social emotional outcomes in the IFSP.
Nice. So we have more time. If there are any other questions for our presenters, please enter them into the Q&A box now. I'm not seeing anything. I'm not seeing any typing. So on behalf of OSEP and all of our presenters, thank you for participating and joining with us today. If you do have any additional questions that come through, we will answer those through email outreach. With that, we draw to the conclusion of the 2024 Smart Beginnings, the 3-day virtual conference. Please remember that you'll be able to access the recordings and the accompanying slides and other materials from this year's event. We will be sending all participants a link to that archived material. Please share that link with everyone you know, inviting them to engage with the information at their convenience. Also, I want to remind all the participants that you can earn continuing education units for participating in this year's conference. An email will be sent to the participants with instructions on how to apply for those CEUs. In closing, please accept our sincerest appreciation for your shared commitment to the high quality education and support of our infants, toddlers, children, and youth with disabilities and their families. Thank you again for your participation.